Welcome back. WSBA Morning News with Gary Sutton here on a Monday morning. Chad Myers is with UPMC Pinnacle Foundation, and we shine our Give Local York spotlight on him this morning, and most importantly on the foundation with which he's associated. And, of course, this is all part of our Give Local York Spotlight series leading up to May 1st when we have our Big Give Day, the 24 hours of giving. You can go to givelocalyork.org and see all the various nonprofits and organizations out there that are so in need of your help. And we'll have 24 hours where we're going to be giving to those organizations. But Chad's with us this morning to tell us about UPMC Pinnacle Foundation. Chad, good morning. Welcome to the show. How are you?
Good morning, sir. I'm doing just fine. How about yourself?
Well, we're doing as well as possible, I guess, during this time. We're all kind of learning how to live a little bit differently. But I know the UPMC Pinnacle Foundation has put together a COVID-19 emergency relief fund. And just part of what you do, tell us all about it.
Sure, no problem. And thank you, Gary, for doing this for the nonprofits that are participating in Give Local York. No, we really appreciate it. And as I'm sure, like with every other nonprofit out there that is participating, our world has changed dramatically within the last month and a half. So we had a big campaign planned for Give Local York. It was a big, fun campaign. And a couple weeks ago, personally, I just started to not feel right about going forward with that campaign or just asking people for money in general. So I reached out to Meg at Give Local York and just asked if they had any consideration in postponing or what they were thinking. And, of course, they had several conversations with their board about pushing forward because the message now, like a lot of these nonprofits are hurting. They're in dire need. They're in danger of closing. So now more than ever, they need the public support. And I think Meg's messaging there is super on point. So we need to get out there. I know a lot of people are out of work and hurting, but some of the nonprofits that are participating are helping those very people. So the people that are able to give, I hope they feel empowered to do so on May 1st. But enough about that. So thank you, Meg, for doing that, and thank you, Gary, for doing this. The UPMC Pinnacle Foundation, we actually started back in the 90s as the foundation that supported Harrisburg Hospital. And as Harrisburg Hospital became Pinnacle, as they started to acquire other hospitals and healthcare facilities up in the Dauphin County and Capital Region, they became Pinnacle Health System. And then the foundation grew to support the Pinnacle Health System, so it became the Pinnacle Health Foundation. And then a couple years ago, as I'm sure we all know, UPMC came in a big way and merged with or partnered with Pinnacle. At the same time, Pinnacle was looking to purchase Memorial Hospital, Hanover Hospital, Lidditz, that was part of Lancaster, and then Lancaster Regional Hospital. So as part of that, UPMC came in immediately following the Pinnacle acquisition of those four hospitals, and we all became part of the UPMC Pinnacle system here in central Pennsylvania. So now the UPMC Pinnacle Foundation, our third iteration, exists to support the needs of our 7 hospitals and our healthcare system right here in central Pennsylvania. Me, myself, I am the only person dedicated to York County. So when I'm out raising money for the foundation, I'm doing it so that it stays right here in our community and goes to support Memorial Hospital and Hanover Hospital and the other various needs that exist right here in the York community. So that's a little bit about the UPMC Pinnacle Foundation. We have over 100 funds within the foundation that support various things. Some funds are restricted to very specific purposes. For instance, we have a fund restricted just to Memorial Hospital, and we have a fund restricted just for Hanover Hospital. So if a need arises and the foundation can step in and pay for a piece of equipment or some other need within the facilities, the foundation can then step up and direct those funds directly to those very specific needs. There are unrestricted funds, so if a general need arises throughout the system, people can come to us, doctors, nurses, whatever, administrators can come to us to address that need, and we can pull money out of an unrestricted fund to get the system what it needs so that we can continue to care for our patients. So that's just a very brief overview. And yep, go ahead, Gary.
But I know the biggest thing you're doing. No, that's okay. Great stuff. I mean, but you're trying to support patients and frontline staff right now during COVID-19 virus. That's where you specifically have gone. And I saw you've used the fund so far to support patients and staff want assistance with purchasing essential medications, child care assistance for frontline employees who are real heroes out there right now, by the way, gift cards, food vouchers, meals for staff working the front lines during the crisis, home monitoring kits so that prenatal patients can continue to visit with their physicians from the safety of their homes, iPads, accessories. Patients recovering from COVID-19 can communicate with loved ones during their stay at the hospital. And you have something called Code Lavender response kits. Tell us a little bit about that as well.
Absolutely. So Code Lavender is an initiative of our spiritual care services throughout the hospital system. And, healthcare workers, these people on the front line, pre-COVID-19 were already in a very stressful situation. I can't imagine being a nurse or a doctor or a tech or whoever else is working the front lines on a daily basis, and then COVID-19 hit. And just think about these people, all of us are losing jobs and encouraged to stay home. Now everybody's got to wear a mask and everything. And these people are out there on the front lines like every day, still going to work, trying to save lives, keep people healthy. So Code Lavender was established a long time ago just to care for people, our employees who are in stressful situations. So we can deliver kits, and they can be molded and made specific to each person that gets them. But they can contain things like tea, snacks, like calming oils and things like that, just to help bring stress levels down for our frontline workers. So it's a really very cool thing, and we're using the COVID-19 Emergency Relief Fund to help take care of our frontline staff by providing those kits to them when they are feeling stressed and anxious.
Jeremy, where can people go as far as a website to see what you're doing and to maybe help out right now?
Sure. So they can check out the Pinnacle Health Foundation at upmcpinnacle.com/giving back, and that should take you right to the UPMC Pinnacle Foundation webpage. You can also check us out on the givelocalyork.org page. So if you do that and just type in UPMC or Pinnacle or UPMC Foundation, you should be able to find us on our page. And we do have some pictures and stuff up there right now. It will change a little bit come the next 2 Fridays. But we're just, we were really excited to do the trail campaign that we had planned before, and we didn't feel right about it. And we knew we needed to pivot like a lot of these other nonprofits, and all of our efforts on this COVID-19 Emergency Relief Fund. We're not going to make a big splash about it again because we know people are hurting. We just want to let people know that it's out there, that we are caring for our patients and staff during this critical time. And if people want to support that, that's great. If they can't, obviously, we completely understand that, but the fund is there to help the community in need at this time.
Well, we really appreciate, and again, pass on to the workers there how much we appreciate what they're doing, and I know they're putting themselves right out in the line there. Go to givelocalyork.org. Check out UPMC Pinnacle Foundation. They have pivoted into a COVID-19 emergency fund. Check it out and help out if you can. Jeremy, good talking to you this morning, my friend. Be safe.
Gary, thanks so much. We appreciate it. You take care.
Thank you, buddy. Jeremy Myers with us here on WSBA Morning News with Gary Sutton, where it is 7:24.